The APSA Diversity, Equity, and Inclusion Committee presents Recognizing and Responding to Microaggressions. The objectives of this webinar are to learn what constitutes a microaggression, to outline the effects of microaggressions on individuals and systems, and to discuss strategies for responding to microaggressions as the recipient, perpetrator, and bystander. The term microaggressions was coined in 1970 by Chester Pierce, who used it to describe minor yet damaging humiliations and indignities experienced by the African American community. This definition was updated in 2007 by Darrell Sue and colleagues to describe brief, commonplace verbal, behavioral, and environmental indignities that communicate hostile and derogatory slights or insults towards marginalized populations. They extend beyond verbal abuses and may be transmitted through dismissive body language or tone of voice. They include general disrespect and exclusion. Microaggressions are derived from our implicit associations and unconscious biases and communicate and work to make recipients feel other or like they do not belong. Microaggressions occur on an individual or interpersonal level, where macroaggressions occur on systemic levels and are manifested in discriminatory policies and governance. There are 4 types of microaggressions. Micro-insults are typically conscious, intentional, and blatant. This is what some people think of as old-fashioned discrimination, manifesting through verbal attacks, avoidance, and discrimination. This includes name-calling and statements like, "They are letting women be surgeons now," or "You people are all the same, claiming your minority status to take the spots that belong to someone else." Micro-insults are typically unconscious, indirect, subtle snubs or humiliations that convey a demeaning message about a person's identity or heritage. These are often not perceived by the perpetrator and include confusing a Latinx physician for the janitor or food service worker, discouraging people of color from wearing their natural hair, and failing to acknowledge minority students and team members. Micro-invalidations are communications that exclude, negate, or nullify the thoughts, feelings, or lived experiences of minorities. These are reflected in the myth of the meritocracy and include complimenting people for speaking English well or repeatedly asking Asian Americans where they are from. Environmental microaggressions are microaggressions that occur at the systemic level. They are reflected in the cultures, processes, and climate of the workplace. These include hallways decorated with photos of only white male doctors, inequitable application of promotion and tenure criteria, and a lack of diversity in leadership. There are a variety of themes of microaggressions, some of which include the ascription of intelligence, making people feel alien in their own land, the myth of the meritocracy, expressions of color blindness, and expressions of gendered expectations. People who regularly experience microaggressions have referred to them as death by a million paper cuts. Research has shown that frequent exposure to microaggressions leads to depression, anxiety, burnout, loss of drive, resentment, isolation, and diminished cognition. At an organizational level, microaggressions are interpersonal events which erode social trust, lead to the formation of cliques, creates a culture of disrespect and distrust, and ultimately diminishes organizational effectiveness. Given this, microaggressions need to be recognized and addressed. In order to prevent microaggressions from occurring, we must be aware that they are happening. This can be very difficult as perpetrators are often unaware that they have occurred, given that microaggressions are often unintentional and rooted in implicit bias. Thus, one primary prevention strategy is learning about and dismantling our implicit biases. Other techniques include avoiding the use of stereotypes, continual updating of the way we perform our introductions, ask questions, and the language we use. When targeted by a microaggression, one will first often ask the question as to whether or not a microaggression has actually occurred, and whether it was intentional. One must then decide whether or not they want to address the microaggression. This is a personal choice in which one must consider their own personal and psychological safety. Commonly taught strategies to respond to microaggressions are the XYZ method, the Open the Front Door framework, and the Action and R.A.V.E.N techniques. The XYZ framework is one of the simplest. Here, you identify the microaggression, how it made you feel, and why it made you feel that way. For example, if you are a female surgeon and your coworkers suggest that hiring another female surgeon is a bad idea because women are too distracted by their families to be equal partners, You may respond to this microaggression by saying, I felt angry when you said female surgeons are distracted by their families and thus not equal partners, because it undermines my contribution to the team and my role as a woman and a surgeon. In the open the front door technique, one first makes observations about the event, taking stock of the facts. One should then review and think about the event, process their associated emotions, and ask for a desired outcome. This may sound something like, when you asked me where I was from, I told you I moved from Texas. You then asked me again. Repeatedly asking me where I am from makes me think that you think I don't belong in America. I feel concerned about this because I am an American and I do belong, and I would like us to discuss this further so we can come to an understanding. The action and R.A.V.E.N frameworks are similar. In both frameworks, the microaggression is identified and explored, following which the impact is made clear, as are one's own thoughts and feelings around the event, with follow-up steps outlined. An example of the action framework is as follows. I am not sure that I understood what you meant when you said that people like me are here only to improve our diversity numbers. I want to better understand. Can you explain what you meant? The recipient then has the opportunity to state their observations about the comment and what had happened. The target of the microaggression may then continue with their explanations, stating, when I hear comments like that, it makes me feel like you think that I'm here only because I'm a minority, not because I can do the work. This isn't true. The discussion can then close with action items for follow-up if appropriate, or you can suggest resources for further education. We all will commit microaggressions. No one is immune to the society in which we were raised and the power structures that have made the white, cisgendered, heterosexual male normative. Committing a microaggression does not indicate that you are a bad person, and even members of marginalized groups can commit microaggressions against members of their own group or members of other groups. If you commit a microaggression, listen and believe the person who confronts you about it. Focus on the impact of your words or actions and not your intent. Don't get defensive and don't be dismissive. Do not minimize the situation. Instead, stop and think about your thoughts, feelings, and behaviors. Acknowledge the other person is hurt, apologize and reflect, and take ownership of your own privileges and prejudices. Apologizing is a key strategy if you do commit a microaggression. The 6 components of an apology include acknowledging responsibility for the occurrence, offering to repair the issue, expressing regret for the event, explaining what went wrong, and repenting and asking for forgiveness. If you witness a microaggression, it is your opportunity to be an ally. Being an ally dispels the notion that the target of the microaggression is simply being oversensitive. As an ally, your voice may be heard more loudly than that of the person directly affected by the microaggression, especially if you are a person in a position of power. When addressing the microaggression, do not minimize it. Focus on its impact, not its intent. Always consider the recipient's personal and/or psychological safety, and be sure to only speak for yourself and not on behalf of the person who has experienced the microaggression. For example, instead of saying, you hurt their feelings, you can say, this is what I witnessed and I am offended, upset, or hurt by it. As a bystander who is not involved in the incident, it puts you in an ideal position to intervene and become an upstander. In some situations, you may consider addressing the microaggression when the recipient is gone, especially if you feel it puts them in an awkward, uncomfortable, or unsafe position. As a bystander, you can simply interrupt the behavior as an abortive technique, or you can name the behavior to address it, seek help to intervene, support the affected party, and document any aberrant patterns of behavior that may emerge. Using modified versions of the XYZ, Open the Front Door, Action, or R.A.V.E.N frameworks, you can help address the behaviors. If the microaggression materializes by making the marginalized person invisible, such as them being ignored or talked over in meetings, you can help by giving credit and amplifying that person by repeating their ideas, ensuring proper credit is given. We will now review 4 cases that highlight examples of microaggressions and strategies to respond to them. This will include a discussion of a gender-based microaggression, which reviews the XYZ and Action frameworks, a race-based microaggression, which reviews the R.A.V.E.N framework, and an example of ethnicity and language-based microaggressions that focus on how and why we apologize.
We present a case of an institution-wide email that was sent in preparation for department photos. The email clarified that the attire that would be appropriate for these pictures and only mentioned a button-down, tie and slacks, and the appropriate dress code. What was your thought when you saw this email?
So my first thought was, I don't have a tie. What am I supposed to wear? Which quickly turned around to a gut feeling of I don't belong here, and a sense of being excluded from a space that I have dedicated my life to. Honestly, it hurt a lot, and I was angry for a second. And then I thought about every female resident that would see this email and feel excluded and hurt, and promptly responded in a way that I felt would not only support my female co-surgeons and trainees, but also call out the microaggression for what it was. When you see this email, what microaggressions do you think are present?
I think that this is an example of gender-based microassault and environmental microaggression. The email itself implies that everybody in the photo would be male, which makes the incorrect assumption that all surgeons are male. This excludes the presence and contributions of the females in the department. And the fact that it came from the departmental level perpetuates discrimination at the systems level. In your opinion, what are ways that this microaggression can be addressed?
So I think it's important to call out microaggressions and bring attention to them. Using the XYZ method allows the responder to express how they are feeling, label the microaggression, and then explain their feelings and response to it. In a situation like this, I may have responded by saying that I felt excluded and hurt by the email because it suggested only men are surgeons, and thus I, as a female surgeon, don't belong here. I felt this way because the email suggested that everyone must wear a shirt and tie to the photo, which I interpreted that the standard professional attire for surgeons was a shirt and tie, which included men and not women. Do you think that we could have applied the action framework in this scenario?
I think that in this scenario, the action method would be helpful to address the author in the email. You could ask the sender why they sent the email, and if they knew that there would be both males and females in this photo. In telling them what you observed, you should highlight the microaggressions and how people responded in this case, highlighting that suggesting male attire for a photo involving both men and women works to exclude women in the group. Then you can explore what it meant to you as a female, including how it made you feel, and if appropriate, the impact gender discrimination has on alienating female members of the department and discouraging females from pursuing academia. It is best to use I statements in your own thoughts and feelings and not to speak for others. It's best to focus on the impact of microaggression more than the intent, given many microaggressions, including this email, are often unintentional and rooted in implicit bias. It is quite possible that the perpetrator was not aware that a microaggression had occurred and the effect that it would have on the residents. After exploring the microaggression in detail, the next step can be outlined. In this case, a recovery included a retraction of the email and resending a more appropriate attire guidelines from the chair. Consideration of implicit bias and microaggressions training session would also be appropriate in this scenario.
Excellent. We'll now move on to case 2.
All right, so let's take a look at Brian and James and their interview for surgical residency. Our candidates are James, who comes with a pretty robust CV. On paper, it looks like a really good candidate.
And then here we have Brian, who is a very similar candidate, if you notice, as James. Also a well-rounded CV. He also did great in high school, also graduated from a California university, and also was involved in significant volunteering during his undergrad, and now they're both applying to residency.
And so it's a panel interview, and there's a host of panelists, and let's go through some of the questions they asked James.
Hi, James. I see you're from West Hollywood. Tell me more about growing up there. Did you get involved in any extracurriculars in high school? What are your hobbies? What are you looking for in a surgery program? Well, it looks like we're out of time. Good luck with your other interviews.
One thing about these questions, they're all very open-ended. They give James an opportunity to just highlight who he is and speak about, what drives him and what his passions are. And so it's not surprising that the assessment at the end of this interview is that he is a warm and candid individual, that he has a lot of passion, and is the kind of candidate you want in your program. Let's contrast this with what Brian's panel interview questions were.
Well, hi, Brian. I see you're from Inglewood. You must be a Lakers fan, right? Did you play any sports in high school? I see you have dreadlocks. That must take a long time to maintain, right? And my daughter is crazy about Nicki Minaj. If you match here, you'll have to help me put together a playlist, please. Well, looks like we're out of time. Good luck with your other interviews.
So in contrasting these with James, you can tell that a lot of these questions are leading and frankly pigeonhole Brian, don't give him a chance to kind of discuss who he is at heart. And so it's not surprising that the conclusion at the end of these interviews was that he appeared a little turned off, didn't really seem excited or engaged, and just his assessment was not as strong as James by the panelists.
Right. And perhaps something important to point out is the fact that the panelists probably did not have any ill intention, and he or she probably thought that they were actually using the information in Brian's application to connect with him, maybe to bond, to create a rapport. But evidently, it ended up acting to hurt Brian.
Well, that's a very good point, Dr. Perez. Often these are well-intentioned questions. They just aren't the right questions.
Right. Now, here's another question for you, Dr. Siddiqui. What should the other panelists have done in this situation?
Dr. Perez, there are a lot of different strategies, but before we kind of delve into them, let's talk a little bit about another case scenario.
Sounds like a plan. So now we have here Brian and Asia. Brian did manage to successfully match into surgery residency, and he's now providing care for this young woman, Asia. Now, Asia is an 18-year-old female. She's got sickle cell disease. And in the midst of a pain crisis, she's admitted to the hospital and she's being cared for by Brian. And there's a situation that gets escalated pretty quickly by the security services at the hospital. And Brian is very discontent, very unpleased with this, and he tries his best to plead with the security officers and to advocate for Asia's dignity as well as her safety.
Now, Asia's attending walk into the room, and this is the feedback Brian receives. He's told that while it's understandable that his people are being treated like that, his pleas were interpreted as screaming at security, who was only doing their job. And then he's accused of having had lost his temper, and his future in the field is threatened. All part of a well-intentioned feedback, but as an outsider looking at exactly what the feedback is, you can see how it could be interpreted as further marginalizing Brian within a field.
That's right. And again, back to the point we made at the beginning, this is not happening in isolation, right? As we mentioned, the attending walked in with another surgeon. So there's this other surgeon who is potentially at a similar power structure and with a similar power dynamic as Brian's attending. And so my question for you, Dr. Siddiqui, is again, but what should this attending do in the midst of this very clear microaggression?
And, we have some great constructs for just that situation. The R.A.V.E.N approach, which can be found at the OHSU's website, allows you to take a structured approach in assessing and intervening in these situations. So one of the first ones is the redirection. And redirection could have been used in either of our two case scenarios. In the first one, with the panel interviews, as a person who might recognize that asking Brian about Lakers and basketball might be pigeonholing him, the co-panelists could have easily expanded the question and said, well, if basketball isn't your thing, what other hobbies might you have? And given Brian an opportunity to discuss his time with chess and debate and engage with the committee.
That's right, yeah. Another thing that a bystander, or an upstander rather, could do when encountered with a situation where they're witnessing a microaggression is, for example, in the second scenario, that other attending surgeon could have asked his colleague and said, I think I heard you say your people to Brian. I just want to make sure I understand you. By your people, you meant your patients, right? Like you didn't mean his people as in another fellow Black American, right? That might have helped the attending perhaps realize that he had committed that microaggression without meaning to.
And it's important, Dr. Perez, when we talk about this, is to recognize that first attending probably isn't blatantly racist and probably didn't even realize how he was coming off. And so when you do ask these questions, you are coming from a place of seeking clarity and curiousness, right? The only way this works is we're not attacking each other at all. We're just trying to create a better environment for everyone involved, right?
Exactly. Yep. Along that situation, the attending could have also just said, listen, in this department, these are the values that our department are trying to seek: equity, inclusion, and the way you spoke to Brian is not necessarily in alignment with those values. And I know you might have not meant anything by it, but just think about it next time you speak to him. You know, he was trying to advocate for his patients, something along those lines, right? Something that emphasizes the values we're striving towards in how that behavior might have deviated from those values.
And again, because we're coming from a place of curiosity and we are all subject to biases that we learn about and try to improve upon every day, it's important to emphasize that a lot of these thoughts, feelings, and interpretations are coming from us. And while that first attending may have felt Brian had lost his temper or was overly aggressive, it would be nice to balance that narrative by saying, this is what I thought and this is what I felt when Brian was advocating for his patient, that he has a deep and resonant voice, and it might be misinterpreted, but I did not feel that he had lost his temper in this situation.
Right. To close what we might call the intervention, or let's say the conversation, you know, one thing that's also always useful is to try to discuss next steps, right? Next steps that both you as the upstander as well as the person whom you're speaking with could do the next time in order to avoid that situation. So in the first case, for example, you might say, as a panel member, you might say to the panelist who led the interview for Brian, to say, you know, maybe next time, just try to stick to open-ended questions, right? That allow the interviewer to shine and express their passions, and et cetera, et cetera. And so that is both a lesson for you, yourself, as well as the person who might have unwittingly made that microaggression.
And I think you make a really good point, Dr. Perez. This is an opportunity for everyone in the situation to reflect, not just the person accused of committing a microaggression.
We will now move on to case 4.
Dr. So-and-so has been asked to consult on Sophia Gomez, a 15-year-old female in the emergency room with gallstones. She's accompanied by her mother. Dr. So-and-so is accompanied by second-year resident, Dr. Kula, who wears a colorful turban and a beard in keeping with his Sikh religious beliefs. Good afternoon. I am Dr. So-and-so, the pediatric surgeon, and this is my resident, Dr. Kula. He may look like he's going to a Halloween party on a magic carpet, but he's a good doctor and will ask some questions about why you are here today and perform a physical exam. Don't worry, he exchanges his headgear for a shower cap in the operating room. I see your family name is Gomez. Do I need to find a Spanish translator for our conversation today?
Well, I was born here and I speak English, but my mother would probably benefit from a translator.
My turban is more than a head warmer, and I'm wearing it as a religious requirement. I usually leave the magic carpet with the valet outside the ED. Perhaps I can translate since I was a Spanish major in college.
Well, that's surprising but convenient. I thought your English was so good too. It looks like we have the United Nations here.
What are the microaggressions here? There's certainly referral to ethnic and religious practices in a very derogatory fashion under the guise of humor. There are erroneous assumptions about language proficiency. Dr. Kula handled the situation well. He was calm, respectful, and he tried to use his own brand of humor to respond. Dr. Kula then requested a meeting with Dr. So-and-so to discuss the incident.
Thanks for meeting with me, Dr. So-and-so. I've learned a lot from you in surgery, but I want to share some concerns I have about how I felt on the service. When you refer to my religious clothing as Halloween costume and joke about the magic carpets, I feel disrespected, especially in front of patients who may not have much contact with Sikhs. Perhaps your intent was to joke around, but it's demeaning and humiliating. I understand I'm a junior resident, but will be in a position for 30 someday and look up to role models for guidance and teaching. I don't feel that I can do my best as a resident when I have been put down by my attending. Perhaps your intent wasn't meant to be harmful, but your comments have made me very uncomfortable. Also, both the patient Sophia and I were born in the USA, and English is our first language, although we speak other languages at home or as part of our studies.
Why, Dr. Kula was just trying to bring some humor into the patient encounter, but I see now that it backfired. I have observed some patients that are very uncomfortable when residents or physicians come in with tattoos, piercings, headscarves, or skull caps. And sometimes they remark to me that about these things. How do you think I should respond to these comments?
I would reassure the patient and focus on the quality of care being provided. You could be supportive of the resident or the staff by saying that some of the special clothing is a reflection of the commitment to our spiritual way of life. Individuals have different preferences for all kinds of things in their lives, and tolerance is a value we promote in the medical system.
Okay, I see your point of view and will try to be more tolerant and sensitive myself. I'm truly sorry for any harm I may have caused you.
Let's focus on the apology. An apology is a statement with two key elements. It shows that you feel remorse for your actions, and it also acknowledges that you hurt someone by your actions. It's important to understand the difference between the intent and the impact. You may not have meant to hurt someone's feelings, but the impact of your words certainly did. Why is it important to apologize? Well, sincere apologies help to rebuild the relationships with people you've hurt. By owning up to your mistake, you then can open a dialogue with the other person. In that way, they can express their feelings, their dignity can be restored, and they can avoid blaming themselves for what happened. Apologizing can help you act better in the future and restore your own integrity in the eyes of others. Remember that the apology may not be accepted immediately, but you'll feel relieved to have made amends for your mistake, and your future actions will show your commitment to addressing your own implicit bias. What are the consequences of not apologizing? Well, you can certainly damage your relationship or your reputation and even limit your career opportunities. If you're a manager or team leader, this may negatively affect your team. It sets a bad example and may create a toxic work environment. Your words certainly need to be sincere and authentic. Never make an apology when you have ulterior motives. And finally, reassure the other person that you're going to change your behavior, and this is vital for rebuilding trust and repairing the relationship.
The APSA DEI Committee thanks you for watching our sessions on recognizing and responding to microaggressions. Microaggressions are minor yet damaging humiliations and indignities that occur on a daily basis. They are derived from our biases and create unwelcoming and hostile work environments. We can work to prevent microaggressions by being aware of our biases, avoiding stereotypes, and monitoring our interactions with others. When microaggressions occur, be an upstander and respond in a way that focuses on the impact of the microaggression and not the intent. Listen and believe those targeted and own your biases and privilege. The APSA DEI Committee would like to thank all those involved in the creation of this webinar, as well as the American Pediatric Surgical Association for their continued support of diversity, equity, and inclusion projects.